Hi, my name is Nicole Cavender with Aero Benefits Consulting. In one of our previous videos, we discussed out-of-pocket maximums and what that means. The out-of-pocket maximum is the protection that is afforded to you when you purchase a health plan. The out-of-pocket maximum is supposed to provide a level of reassurance that you won't spend any more than that amount of money out of your pocket throughout the use of that plan that year. But out-of-pocket maximums are increasing. And as of now, a family could face an out-of-pocket maximum to upwards of $13,000 a year. This is, of course, in worst-case scenario. It's important to understand your plan details to understand how that out-of-pocket maximum accumulates. But let's take, for example, this worst-case scenario so that you're prepared. I think that's the best way to buy an insurance plan. If you look at a high-deductible health plan, let's say we have a $6,000 out-of-pocket maximum. And we also have a $6,000 deductible. So day one when we're going to the hospital, that plan, anything we get done, we're gonna pay $6,000. However, once we've paid our deductible and our out-of-pocket maximum is the same amount of money, that means that we've spent all we have to spend that year. So that plan can cost very little per month compared to some of your other options because it's a low-cost plan with a very high deductible. Oftentimes, people believe the only way to not worry about that $6,000 deductible is to buy up into a richer health plan, basically buying down your deductible and trying to not reach that out-of-pocket maximum. Well, that can be great, except that can be very expensive. And what if you never receive the care? Well, that money's now been given to the insurance company and it's gone. But there are other ways that you might be able to mitigate or not worry about that risk of that high deductible that you have purchased because it has a lower premium. That higher deductible, it could result in you going to receive care and having to pay out of pocket. So how are we going to manage that risk? There's plans that you can buy even outside of your employer, like accident, critical illness, and hospital indemnity plans. These plans often cost less than it would cost for you to try to buy up to a richer health plan. And they also pay for an occurrence, meaning if you fall down and break a bone, or you get diagnosed with cancer, or you get admitted to a hospital, each one of those types of occurrences will pay out a certain dollar figure. Well, that check, when it comes to you, you could use that money to then pay some of those high-cost medical bills that you received because of that cancer diagnosis, or because of that fall or broken bone, or because of that hospital admission. So using these low-cost accident, critical illness, and hospital indemnity plans offered by a number of carriers can often help kind of supplement the gaps in your health insurance plan itself. So it's important to talk about how you might be able to find other types of coverage and not have to spend and throw your money into a health insurance plan to pay for health insurance expenses.